Welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Today, I am in studio with Dr. Ron Silverman. He's joining us here from KCI as Senior Vice President and Chief Medical Officer, and he's going to talk with us today about a presentation at the 2018 Symposium of Advanced Wound Care. Thank you for joining us today, Dr. Silverman.
Thank you very much for having us.
Right. There was an oral presentation, as I said, at this 2018 Symposium of Advanced Wound Care. Talk about this presentation and what does it mean for this brand new therapy that we're going to discuss.
Okay, well, thank you. So this presentation was about a program that we have called Ion Progress Remote Therapy Monitoring. And this works in conjunction with our ActiVac therapy. ActiVac therapy is the therapy that provides VAC therapy, which is a type of wound care for patients with wounds in the home. And it is the first negative pressure wound therapy system to be. KCI is the first company to bring negative pressure wound therapy over 25 years ago in the United States, and we continue to innovate on this each passing year. Our newest innovation, again, the Ion Progress Remote Therapy Monitoring, this allows us to monitor whether or not a patient is actually adhering to the therapy that has been prescribed to them at home.
Okay.
It's the first system to deliver this sort of continuous at-home monitoring for negative pressure wound therapy. And it leverages digital connectivity in order to monitor this adherence. This data is transmitted securely to the KCI Ion Progress Care Network team, which is a group of highly skilled and trained nurses who then have the opportunity to interact with the patients directly as well as the caregivers to encourage compliance with our therapy. So the device, it's a medical device that's placed on a wound, is placed by a physician or nurse, and then the patient is sent home. And at least twice a week, someone visits their home in order to change the dressings. But it is a machine that includes computer software and hardware that provides negative pressure wound therapy, essentially suctioning on the wound to stimulate the wound to get smaller much faster than other techniques. And this has been there have been many studies that document increased rates of wound healing, the ability to fill in a wound and have the wound essentially get much smaller, much faster on a variety of types of wounds. One of the things that we've learned over the years, though, is that if a patient is not adherent to the therapy, in other words, if they turn off the machine or for whatever reason, maybe there's an alarm and the machine gets turned off, then obviously the patient does not get the benefit of the therapy.
What's the patient learning curve for using the software and the device?
So the patient really doesn't have to do anything. Essentially, there's a nurse that comes to their home a couple times a day. But if there is an alarm that goes off, ideally the patient would then call the caregiver to decide what to do. But what we have found is that in many instances, patients were simply turning off the machine. And so the idea of this study was to say, hey, if we can remotely determine that there's something going on, either the machine's turning off or there's an alarm, and we can proactively reach out to the patient, call them, then we can actually dramatically increase the adherence to the therapy. And when we say adherence to the therapy, we simply mean that the patient continues to get the therapy. In other words, they don't turn it off or shut it off or it turns off itself or something like that.
That's why I was asking about how much the patient understands how this device works and the importance of adherence and making those calls and contacts when that is appropriate.
Well, we think that we can always do better with patient education, and that's one of the nice things about this program. As soon as a patient is sent home with our therapy, they get a call from our group of nurses in the Ion Progress Care Network. And they introduce themselves, and they have another opportunity beyond whether it was in the wound care center or the hospital, beyond whoever explained it to them initially. We have someone who's truly an expert that can go through everything yet again with them. So that's a beautiful benefit of this program. But the main finding of the study was that the vast majority of patients, when they got a second call, so in other words, when we were alerted remotely through our remote therapy monitoring that something was amiss, something was going wrong, maybe the machine was alarming, or it was simply just turned off, if we called the patient, the vast majority of them, 73.5%, demonstrated an increase in compliance or adherence with the therapy on the following day, which is, that is a very high response.
Was there any other positive results other than obvious patient adherence at such a high percentage rate?
Yes, I think the idea or the concept is that in addition to just getting adherence, you would hope that translates into some benefit, some clinical benefit to the patient. And one of the things that we noticed in this group of patients, and again, it was over 500 patients studied, was that when we looked at the patients that increased their percentage of time that the machine was being utilized, so going from less than 60% to those using it over 90% of the time, they had a 50% increase in the rate of volume reduction of their wound. So in the percent change in the volume of, the space of the wound would demonstrate a significant reduction in the rate that it was getting smaller.
Wow. Now, in wrapping up, Doctor, first of all, what in your opinion do you see as the future of RTM based on these very positive results? And tell our listeners where we can go online and learn more.
Okay. Well, so first of all, the benefits of this are not only in clinical outcomes for the patient, but also in the tremendous economic burden that our healthcare system faces due to chronic wounds. We know that there's over 6.5 million patients in the United States alone affected by chronic wounds. The cost is extremely high. About 24% of all Medicare readmissions are wound-related. And, obviously making a dent in that is good, not only for each individual patient, but for the payers as well as, the entire nation and our budget. Could you give our listeners a website where we can go and learn more? Absolutely. If you just simply go to Acelity.com, that's ACELITY.com, and you will learn about the Ion Progress Remote Therapy Monitoring Program. Well, I thank you for coming in today. Very good. Thank you very much. All right. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Ron Silverman. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.